Good afternoon, everyone. Thanks for joining us. My name is Teresa Freed. I'm the Assistant Director of Public Affairs and Communications for Johnson County Government. And as usual, we have with us Dr. Sami Ariola, Director of Johnson County Department of Health and Environment, and Elizabeth Holshoe, JCDHE Epidemiology Director, and Allison providing ASL. Thank you all for being here today, as usual, again. Just to start us off with, we have a new location for the clinic today, and how did that go?
Thank you, Teresa, and good afternoon, everyone. Today was our first day at a new location in Lenexa, and we intentionally wanted to take it slow, see how things flow, how things run. And so we vaccinated about 570 people there today, and went pretty well. Feedback from staff's been pretty good. The flow was really good. Packing was fantastic, and so tomorrow we're going to increase that number. Today we targeted 500 people. We ended up doing 570. Obviously, those other 70 were also planned. I do want to emphasize that they weren't just people randomly showing up. Those were planned intentionally to see how things work. And tomorrow we have 750 appointments, and we expect to vaccinate slightly more than 750 there tomorrow. So far, so good. And then Thursday we go to about 1,000, and Friday we go to 1,400. Those numbers are expected to increase starting from next week, when we really are going to work longer hours and then feeding more people per hour into the flow. But also I do want to remind people that we also today and until Thursday simultaneously running clinics at the Oakland Field House. At the Oakland Field House today, we vaccinated just under 1,200 persons, primarily there for their second dose. We have plans to vaccinate about 1,250 people tomorrow, also there for their second dose, and 500 on Thursday. So the clinics are running on both ends, and things are flowing very well. As always, after the clinic, I'll debrief with staff and just understand what the numbers are, understand what the challenges are. We're pretty happy about how today went at the first facility, at the new facility on our first day. So we're looking forward to doing that again tomorrow. And as we plan ahead, and one of the key reasons that we wanted the fixed location was it's not just about being able to have a place where we don't have to assemble and disassemble every day. It's also to have flexibility. So, and those are tied to issues of equity. So if I'm working 8 to 4 right now, I'm at a disadvantage to come into the clinic. So we're looking at, we're going to begin to offer after hour vaccination and weekend vaccination. We're working out some of those details, and we should be providing more details very soon. So again, very excited that we have a location that's really large. Will not be confusing to people, but also our staff can just go to one place and reduce the efforts behind the scene that we have to put into running the clinic. And I think one thing that we haven't mentioned also is it allows us to centralize a lot of our activities. In the past, all of those packages that we used to run the clinic are being done in our Letha building and then transported to the locations. Right now, we can do all of those at this new facility. So it's a lot of advantages to that I'm personally very excited about.
Well, I know I went to the Oaken facility, I think last week, maybe to take a tour over there, and I noticed everything is just, it flows so nicely. Everywhere you turn, there's somebody telling you exactly where you need to go. So can people expect that exact same thing at this new location? And also, you know, the buses going in and out of parking and things like that to drop people off. I mean, are all of those same accommodations part of this new facility?
Oh, yeah, absolutely. It takes a lot of people to run the clinic, and that's just the clinic, because a lot of the steps that allow us to run the clinic takes several people also working several hours to make sure that supplies are there and things are working very well. So part of our goal is not just to run people through the clinic, is to ensure that the flow is good, but also to ensure values, customer service values that are consistent with what the county expects and with what our residents expect. So yes, we have our staff there. We have volunteers from other Johnson County departments. We have volunteers from the community that are assisting. It takes tens of people to run the clinic. We've got people assisting with parking, like you mentioned. We have this wonderful relationship and collaboration with our transit authority and Josh Powers working in the new location. We actually have a place for staff and volunteers to park that requires a shuttle to move people. They're there. The shuttle is constantly working, and then we've got people that are assisting with parking. We've got people that are assisting with people coming in. We've got wheelchairs that people are assisting with. We have volunteers virtually throughout the building, checking, vaccination checker. We've got people to assist you if you have not completed your form while you are there. Now we do ask that you complete your form, but we've got assistance all throughout the location. Again, just to ensure that whatever help our residents need, we're able to provide.
And although we have this new great central location, we still want to emphasize again that people need to make appointments. Is that right? They can't just show up, or they shouldn't just show up. And what happens if they do?
Elizabeth?
In short, you'll be turned away. If you do not have an appointment, unfortunately, we cannot serve you. We cannot vaccinate you at that time. We bring just the number of doses that we need for the number of appointments that we have, and really any remaining doses that we have left over at the end. We really try and vaccinate our staff and our volunteers who are really helping out with the clinic, sort of as a nice perk for them, but also it's a great way they are in these community centers and in other positions. So if you don't have an appointment, please don't show up. If you do show up, you will be turned away.
I think it's also a good opportunity for you, Elizabeth, if you want to just describe our processes for, we've got the online interest form for all the faces open now, and the process for getting appointments and booking appointments.
Absolutely. So if you are interested in getting a vaccine and you're a Johnson County resident or you work in Johnson County, we ask that you go to jocogov.org/interest survey. If you have filled out one of our interest surveys already, if you were a phase 1 worker or a phase 2 65 and up, or in one of those categories, you don't need to fill out our survey again. We've got your information. And then as we open up appointments each week or for the following week, we take a group of those individuals who have filled out the survey and ask them and invite them to schedule an appointment. We do know that our link has been shared widely online outside of those very directed emails. So we are looking for additional solutions. We're trying to implement one hopefully in the next several weeks where we'll be able to pre-register you. If you've signed up with our interest survey, we will put your information in, and so then you can just go in with your name and your date of birth, and you will be registered in our system and can then schedule an appointment. But for now, if you do get one of our emails, please don't share it out. We saw this week when we were trying to reach our last group of 65 and up that we've been able to identify. We did a poll last week and found out we had about 3,500 Johnson County residents who are over 65 who had not received the vaccine. And we sent them an invite, and lo and behold, the majority of our appointments were taken by people under the age of 65 again. And so if you get an invite, please keep that to yourself. And please respect the process. I think that's really what's difficult and will become increasingly difficult as we move forward into phases 3 and 4. We are very reliant on our community members to participate in this process and respect the process. So if it's not your turn, if you don't have a pre-existing condition, hold off. Really, these vaccines, the reason why we are allocating in the phased way that we are is to ensure that those who are at highest risk for severe outcomes or severe illness, or who exposing somebody who's at a really high risk, that they have the opportunity to get the vaccine first to protect them or to protect that person they're caring for. And so if you're a healthy individual, as much as, we certainly appreciate that you want to get the vaccine, that's really taking away that shot from somebody who maybe needs it a little more than you do. So please be patient. We're expecting hopefully some increase in vaccine allocations in the coming weeks. And that will really allow us to open up these appointments to get everybody in even quicker than we have been able to at this point. So continue to ask for patience, fill out our interest survey if you have yet to do it, and stay tuned for emails to get a vaccine appointment.
All right, that's very good information. And speaking of increases in vaccine hopefully coming our way, there's been discussion about another vaccine this week, AstraZeneca. So if you can kind of provide the latest on what we know about the approval process on that one.
Yeah, thank you, Teresa. So we have seen what's in the news also. I think it's pretty good, really incredible that in just about a year of dealing with this virus, that we have 3 approved vaccines that we are currently using, and we're also aware that AstraZeneca has been used in other parts of the world, and we know what the news are. I think for us in the United States, what's in the news today regarding data and efficacy and all of those details, for us, our focus really is once they have an emergency use authorization from the Food and Drug Administration, it becomes another tool that we'll use. Right now, it's not quite there. We're following the news, but it's not currently available to us. We have 3, though, that are very effective, and those are the ones that we're using.
All right, that's good information. And can you reiterate too, what is Johnson County using? I think primarily we're getting Pfizer, is that right?
Right now, yeah, we've been getting a lot of Pfizer, but we have gotten some Johnson & Johnson that we have used strategically. For a long time, we didn't quite get a lot of Moderna, but we have gotten some recently. So basically, in any of our clinics, right now, you are more likely to get Pfizer. It is possible that you get Moderna, but Johnson & Johnson, we have not used in our clinic. We have used it strategically. In the coming days, we hope that we get more of Johnson & Johnson. We'll do our best to let people be aware of what we are giving in the clinics, but you don't really have a choice as to which one, and there's really no need to. We've got 3 vaccines that are 100% effective against death, 100% effective against hospitalization, a very high level of effectiveness against severe diseases. So we're pretty happy with all 3. And so we also don't have the resources to have you pick between the 3. So whatever we're giving, you take, and we know that it will give you level of protection that is needed.
I'll also jump in there and say that that's the same for our healthcare partners and our pharmacies as well. So our healthcare partners, our hospital systems, they are getting that vaccine allocated through the state from us through our allocation. And so for the most part, that is Pfizer. The Johnson & Johnson vaccine is not going to our healthcare partners, except for these really special populations that tend to be harder to reach, individuals experiencing homelessness, individuals, for instance, in the domestic violence shelter, and those sorts of situations. So certainly, if you're interested in a certain vaccine, that just may not be possible. And then the pharmacies, I believe, have predominantly been getting Moderna, but that's also a mixed bag. So if you get an opportunity to get the vaccine, we definitely recommend you do that at that time. We just have no visibility on even a week or 2 from now what kind of vaccine allocation and which vaccines we're going to get. So if you have that opportunity, go ahead and jump on it if you're interested in the vaccine.
And I know, of course, the ones that we're getting predominantly have 2 doses. And so can you give us an update on how much better that's working in terms of scheduling by simply having people return to the same location in time for their second dose?
I'll let Elizabeth take that also.
Yeah, so a few weeks ago, we changed our process for getting people second doses. We had originally been sending an email back out to individuals who'd gotten a dose through us and asking them to reschedule a second dose. But that was very cumbersome for everybody involved, our team, for the residents of our community. And once we felt confident in our vaccine supply and that we would be getting those second doses when we expected them to, we were able to shift into this mode of you come back to the same location, the same time, 3 weeks after your last dose, because we're giving out Pfizer and that's that time frame. And that's been working really well. There will be a little bit of squishiness in the middle where we have to ask people, I believe, is it this week to come to Lenexa when they're for their
Mhm.
second dose.
Yeah.
But I would also like to point out too that this is for Johnson County's public clinics. We received some feedback today. As most people know, we've been working with Children's Mercy to run childcare and K through 12 clinics. That is scheduled separately in a different way. So when we talk about this, just show up 3 weeks from the time and the same location. What we're really talking about are large clinics if you got vaccinated at Oaken or if you're getting vaccinated in our new Lenexa facility. So, but I think it's gone really well. I think it's far easier. We've been able to provide some flexibility for people who really can't come back in that time frame, but I think it's been a huge relief for our staff. And I think for the residents too, because they're not wondering when they're going to get that email or when their dose is going to come. And they have confidence that, yep, 21 days, I'll have that second dose.
And that has been very helpful. Early on in the process, we had to set up additional appointments for people to book the second appointment. And because when we open up those appointments, people just take them, even though we send it to targeted people, because people are sharing those links. This is really been, I think, very good for our residents. You book an appointment once, you get your first dose. We tell you when and where to show up, same location. Other than last week, this week we are doing mostly second dose. Other than last week, if you take your vaccine last week at Ocon, you need to come back to the Lenexa location. But by and large, you've had to just show up, same place, same time, and get your second dose. So that's worked pretty well.
And back to the topic of our interest survey, the latest interest survey is for all phases. So that's different from what we had done previously with healthcare, and then also, the phase 2 survey. So this new one has quite a few questions. Some of them are related to age and demographics, things like that, contact information, but there's also some health specific questions there. And so if someone is just quickly filling this out, and then they close it, they're done, and then they realize, oh, I didn't fill that out correctly. What's the process to update their information? Since I know that we're prioritizing these largely based on the order in which they're received and to some extent, some of those conditions. So can you talk about that?
Absolutely. So my first recommendation, when you complete the survey, you come to a page that allows you to put in your email address to get an email confirmation, but there's also a code there. And so if you're filling this out, I would strongly recommend you write down that code. It does not come through in that email. So you are going to have to take a screenshot, write it down, make a note of it. And what that allows you to do is if you want to go back and double check your information, you just have to enter that code and it will allow you to edit whatever information you need to. The second option, just because of call volume, would be just to go in and re-enter your information. This is really effective in particular if, it's been a few hours and you're like, oh, you know what, I don't think I did that, because it's not going to really alter your place in line. Now, if let's say you did it 3 weeks ago or the day we launched it and you're like, oh, you know what, something new has come up. Maybe now, you've been diagnosed with something, something has changed. You certainly can call us, or you can just re-enter your information and create a new survey. So any of those are options. However, if you're filling it out, I would strongly recommend you write down that code that's in there, and that will allow you to edit any of your information in the future.
Good information. We've gotten quite a few questions through email and social media just about how long this process is going to take. So can you talk about how substantial this group of phase 3 and phase 4 and kind of how long we think at the current pacing of the doses we're receiving, we're going to be able to move on?
Right. So at the current level of vaccine that we receive, it's going to take a while, but the governor and the state's been pretty consistent that by next week we should expect to get more doses. So that's a good thing, and that's the first piece. The second piece is really tough to estimate the number of persons in that group. We do know that our population that's eligible for the vaccine, 16 plus, will be about 475,000 persons. And so if you look at that and you look at what we have done thus far, or including people that remains in phase 2, you will see that phases 3 and 4 are also pretty large, perhaps larger than phase 2. So if it is, we might be talking about 150, 180, maybe even 200,000 persons. So it's going to take a while. But my approach to this is, let's assume we're getting 20,000 doses, 25,000 doses in the county. That's 25,000 persons less or fewer every week. And so again, this is a marathon, but we're looking at our numbers every week that we look at it. We see that we're giving more and more first and second doses to our residents. And so that's we started off. Elizabeth started off talking about patients. That's the same thing. If we get more, and we have our partners able to enhance their ability to give out more doses, and we're able to bring in more providers, that's going to be quicker, but really tough to predict until we know how many vaccines we're actually going to be getting.
A lot of the conversation we're seeing on Facebook right now is just people giving each other tips on where to get their vaccine, where it's available. And I think that's happening quite a bit. So can you talk again about just taking whatever is available, and are we comfortable with people getting vaccine in different locations, because they do have to go to that same location, right, to get their second dose if it's a 2-dose vaccine?
Oh, absolutely. We are comfortable with that. We know in Kansas, basically, the encouragement from the state is get the vaccine wherever you can get it. And so there are more doses that are available in the rural counties for different reasons. They're not quite getting as many as we are, but relative to their population and the percentage of uptake, they tend to have additional doses. And we are aware that some of our residents have driven a couple of hours to places to get vaccinated, and that's okay. In our case, interest is very high. The doses that we're getting are not enough for our residents, but that's okay. We also have to balance that out with the ability to give out the vaccines, and so we're doing our best. People, if you can get your vaccine at our clinic, do it. If you can get it from any of our partners, our health systems, do it. If you can get it from our pharmacies, do it. We expect more vaccines to go to the pharmacies also. And if you have opportunity outside of our county to get it, that's perfectly okay too. The goal is the same. We want you vaccinated. We want a very high percentage of our residents to be vaccinated.
And I know we're tracking the data of how many people or how many shots we're giving out. And so how does that factor into kind of keeping track of, reaching that population immunity? Are we able to even do that, since we have people going in and out of the county to get vaccinations?
Yeah, so tomorrow is always my favorite day because it's data day for vaccination data. We get our report from KDHE every Wednesday where we see how many new doses we've been administering over the last week. And the way that this works is if it is a Kansas provider, whether that's a pharmacy, a hospital, Johnson County Health Department, or any other health department in the state or any other hospital, they all have to report to the state of Kansas. So whether you got your vaccine in Parsons or in Wichita or Topeka or in Olathe, we will have your information, and you will be counted as a Johnson County resident who's gotten their dose. Now, if you get your vaccine in Missouri, I know that individuals have gone to, say, pharmacies in Missouri to get their vaccine. We will not have that information because those pharmacies are not required to report to Kansas. So that is a limitation really in our ability to have a really great view, because particularly living on the state line. But I do think that the majority of residents do seem to be getting it in Kansas somewhere. We've heard a lot of stories about people driving, but that's certainly the problem is we just don't know what number, right? I don't know how many of our residents have gone over to Missouri to get their vaccine. So it is certainly a limitation, but one we're not unfamiliar with living on a state line. So, we hope that as we move forward, because those individuals are getting reported to a national database, that KDHE may be able to remedy that and really start accounting for those individuals as well. So certainly a limitation, but anywhere in Kansas, we've got you, we're counting you.
And I know people, since the pandemic started, have been interested in the data. So we do have places that people can go on our website, and they can also go to the state's website to access some of that information if you're interested. So that's jocogov.org/coronavirus. We also have the KDHE website is a great resource if you want to look at kind of a county by county comparison, or just get like their weekly updates on vaccine distribution. That's all really great information. All right. Well, any closing remarks from either of you? Anything you want to leave our listeners with?
We are continuing to do the best that we can to prepare and work with our partners, other providers, to get vaccines into the arms of our residents as quickly as we receive them. We are pretty excited about the news that we should expect to get more vaccines coming next week. That means we're able to pull in more providers or provide more vaccines to our providers. And that's good news for our residents. And so we are going to continue to provide you information. We like the interest. Keep up that interest. You want the vaccine, we want to give it to you. And we appreciate your patience as we walk through those processes. Thank you.
All right, great information. And today's Tuesday, tomorrow's Wednesday. So we'll see you all back here tomorrow at 4:30. Have a great day.